Strep throat and strep throat signs and symptoms. An infection by bacteria which makes the throat painful and swollen is known as strep throat. Streptococcus bacteria from group A are responsible for causing strep throat. This infection can infect both children and adults from varying age groups. But it is synonymous with children aged between 5 years and 15 years. Strep throat is a contagious infection that can be spread through coughing and sneezing. Strep throat signs and symptoms. The degree of the strep throat signs may differ from individual to individual. Other people may suffer minor strep throat symptoms such as throat sores, while others may display acute strep throat signs including swallowing challenges and high body temperatures. Common strep throat symptoms are throat sores with white and red patches, headache, cold, lack of interest in foods, neck showing lymphatic, difficulty swallowing food. These strep throat signs begin to appear usually 5 days after an individual is exposed to Streptococcus bacteria. Best time to seek doctor's appointment. Take note that throat sores are not only caused by infection of the strep but many other diseases may result to throat sores too, including flu or colds. Infection of the sinus. Reflux acid strep throats that occur as a result of other illnesses often disappear within a number of days without the individual using any medicines. You may need to see a doctor if strep throat lasts more than 2 days. Strep throat displays whitish patches or splotches which appear reddish on the tonsils, or on the roof of the mouth. Strep throat having pink sandpaper kind of rash on the layer of the skin, breathing problem. Swallowing problem. How to diagnose strep throat. If you are experiencing continuous strep throat signs, your physician could check your throat and examine strep throat symptoms of swellings. The doctor could also find out whether your neck is showing lymph nodes that are swollen or inquire of other strep throat signs. If the physician discovers the strep throat symptoms that indicate that you got strep throat, he may have to carry out an immediate strep test right there. The strep test carried out will find out whether your strep throat has been caused by a germ, bacteria or strep infection. So as to take samples from the back of your throat, your doctor will have to use cotton swab and refer the collected sample to the laboratory for examination symptoms of bacteria. Usually the strep test results are out in approximately 5 minutes. If the test results turn out negative and still your physician believes that you got strep throat, he may opt to submit the collected sample to another testing laboratory. The outcome could be made ready in a couple of days. How to treat strep throat. By using antibiotics. If the diagnosis results show that you have a strep throat infection, your physician could provide you with antibiotic to manage the infection. Antibiotics hinder the multiplication of the infections and the bacteria. Many kinds of antibiotics are out there, but amoxicillin and penicillin are mainly the ones prescribed for controlling and treating strep throat symptoms and infections. To completely get rid of the infection and destroy the bacteria, ensure you complete the prescribed dosage for antibiotics. It is some people's custom to stop consuming the medicines whenever they notice improvement, but this is risky as it may cause a relapse and strep throat signs may recur. Treating strep throat at home. Apart from use of antibiotics to handle strep throat, homemade solutions have proved to be very effective in managing strep throat symptoms. These homemade solutions include taking warm tea. Taking warm tea and water lemon can be very helpful. To numb your throat sores, drink cold liquids. Switching a mist humidifier to cool the environment. But painkiller medicines from pharmaceutical outlets, e.g. acetaminophen or ibuprofen. Sucking lozenges can help a great deal. Gargling a mixture of half teaspoonful of salt to a glass of warm water viewpoint and resulting strep throat complications. When strep throat is properly treated, strep throat symptoms will most likely go away in a week. On the other hand, when left without treatment, strep throat may result in serious health complications such as infection to the ears, joint, skin and heart inflammation, generally referred to as rheumatic fever, infection of the sinuses caused by swellings normally called sinusitis, development of scarlet fever, kidney inflammation commonly known as post-streptococcal glomerulonephritis, appearance of tinny teardrop spots all over the body usually known as guttate psoriasis, mastoid bone infection also called mastoiditis, Accumulation of pus in the back end of the tonsils, commonly identified as peritonsillar abscess. Just in case you see no change in the strep throat symptoms persist 48 hours after taking of antibiotics, please ensure you consult a doctor. Your doctor could choose to give you another stronger antibiotic or simply change the medication so as to completely treat your strep throat infection.